Good morning. This is the Anchorage EOC operational update for June 16th. Situation, go ahead.
Good morning. Today is day 469 of our response. As currently reported, locally, we're up 85 cases in the last week with 0 new deaths, and 0 new hospitalizations. And statewide, up 237 cases, 4 deaths, and 13 hospitalizations. Next slide. For 213 resource requests, we filled or otherwise satisfied 1,766, an additional 3 since the last report, with 25 currently open and working. Next slide. Our mass care data is currently unavailable, although that's being worked on. Next slide. In the last week, at the visit testing sites, there were 2,017 sample collections performed. And in the last week, at all pods, there were 1,325 doses administered, with 78,258 to date. End report.
Thank you, Situation. Weather, testing, vaccinations, go ahead.
Good morning, everybody. This is Pat Ryder, the Emerging Infectious Diseases Assistant Program Manager. Today with testing, Visit Healthcare had a decrease of 21.2% over the previous 7-day sample collections. As of June 15th, our estimated daily growth rate is a decrease of 4.96%. Our 14-day average reproductive rate is 0.781. Now we're keeping that number below 1, which is good. And our 14-day average case rate is 2.5 for every 100,000 people in the population. Our current alert level is low. Positivity rates and case numbers continue to decrease. And per CDC guidelines, testing for shelters and assisted living homes has been decreased to once per month. With vaccines, Visit Healthcare clinics had a decrease in average daily vaccinations of 25% from the previous week. For upcoming pop-up clinics, on Thursday we have the Alaska Rock Gem and Moose's Tooth event, and St. John's Mobile Food Pantry. On Saturday, we have Juneteenth at the Northway Mall and the Solstice event downtown. And this Tuesday we have Bass Pro Shops. Just an announcement, we have some changes coming to the clinic hours beginning next week. The Diamond Center, the old Forever 21 spot, will now be 7 days a week from 10 a.m. to 9 p.m. Dempsey Anderson drive-thru will be Tuesday through Friday, 8 a.m. to 2 p.m. The Northway Mall drive-thru will be Friday through Monday, 12 p.m. to 8 p.m. And Blood Bank of Alaska will be Monday through Friday, 12 p.m. to 8 p.m. All clinics will offer all 3 vaccines with no appointment necessary. Just a reminder, mobile vaccine clinics can come to you wherever you are, be it a business, church, or other organization. For more information or to schedule, please dial 907-531-5100. So with regards to messaging, as mentioned, our overall risk level is low. This is evidenced by the fact that we witnessed a 21% decrease in daily cases from last week. That said, with over 53% of eligible residents ages 12 and over having completed a COVID-19 vaccination series, Anchorage comprises 2 subpopulations with very different COVID-19 risk profiles. Unvaccinated individuals currently experience a risk for COVID-19 infection equivalent to an average case count of approximately 4.5 for every 100,000 residents, whereas their unvaccinated counterparts experience a risk equivalent to 0.45 for every 100,000 residents. Also worth noting, while our current reproductive rate may have shifted upwards from last week's, our estimates may become more variable with cases only being reported 3 days per week. And finally, it's worth mentioning of a few additional contributing factors. These include more transmissible variants, continued light demand for new vaccinations, and an increased number of travelers to Alaska during the summer. This concludes testing the vaccines. Barring any questions in the report.
Thank you. Mass care, you're next.
Good morning, this is Sean Hayes, Mass Care Branch Chief reporting. Our projected discharges from our Q&I location are 3 today and 4 in the next week. The good news is we have no active COVID cases in our Q&I location. These are just quarantining. Our numbers continue to decrease at the Sullivan Arena. We have 6 that have moved into permanent housing, with another 10 projected in the next few weeks. We also continue to see outflow from our non-congregate sites into permanent housing. End of report. Thank you.
Thank you, ma'am. Contracts, logistics, go ahead.
Good morning. This is Wendy Reese, Contracts and Logistics Lead, reporting. We are currently 6 contracts, actually 7 contracts that have made the assembly June 22nd for approval. We continue to learn lessons from our demobilization of the Fairview Rec Center. There is nothing currently to report for logistics, and contracts continue to support critical timelines and requirements for the extensions that will be on the June 22nd assembly meeting. We continue to realign positions with added personnel. End of report.
Thank you, ma'am. Up next, finance. Go ahead.
Good morning. This is Audrey Jo Malone reporting for finance. Currently, we have encumbrances of $16,886,889 with actual spent to date of $62,303,266 for a total of $79,190,155. We are currently seeking cost recovery for expenses by way of federal funding. And please continue to submit all invoices and some more supporting documentation to EOC invoices at anchorageak.gov. Report over.
Thank you, ma'am. Safety, go ahead.
Hello, everyone. This is Public Works Safety Officer Aaron Carter. I'm filling in for Annalisa Roberts for this briefing. We are in week 3 of National Safety Month. Our topic today is psychological safety. We are advised by the National Safety Council that being able to be oneself at work without fear of retaliation is necessary for an inclusive safety culture. Leading organizations focus not only on physical safety, but psychological safety as well. Keep in mind, a safe work environment not only protects lives and livelihoods, it provides a place where all employees can feel emotionally and mentally safe. And we recognize that mental well-being is a critical component of overall worker health and safety. Keeping this on the top of your mind involves responding with respect when interacting with coworkers and clients, asking for and considering the opinions and perspective of others, speaking up if you observe someone who isn't creating a psychologically safe environment, and encouraging employees to seek support when needed. For more information on this topic and many more, please visit nsc.org. Thank you very much for your time and attention. End of report.
Thank you, Safety. Public information, please go ahead.
Good morning, everyone. This is Public Information Officer Heather Arono. Wanted to just mention the photo that you saw at the beginning of the slide. That is Rue, one of the National Crisis Response Canines, who was able to be at the Diamond Center pop-up clinic for this little girl, Anna's 12th birthday. That's right, for her 12th birthday, she wanted to get a vaccine, and Rue was there to help because she's a little scared of needles. So thanks to everybody for making that possible. We are getting ready for the Juneteenth citywide celebration on Saturday, this Saturday, June 19th. This is part of our Sleeves Up for Summer campaign. We will have a booth there, so if you are thinking that you're looking for a fun event, this is a family-friendly event. There will be music, food, vendors. This is really encourage everybody to come out for that. We continue our outreach to our members of the community, just sending that daily email out with information about new pop-up clinics, appointment availability, and some frequently asked questions. We are always looking for businesses and organizations who might be interested in hosting pop-up clinics, so we continue that outreach. And just wanted to put a note of appreciation. Public Information Officer Calais Rupp has been working with us for the last few months. She has been a tremendous amount of help to the team. Today is her last day. We're hoping we might be able to get her contract extended and bring her back later in the summer, but she's going to go enjoy some time with her family. So just wanted to extend our sincere thanks to her for all of the help she's been. End of report.
Thank you, ma'am. Liaison, go ahead.
Good morning. This is Celeste Prescott, Liaison Officer for the Anchorage EOC. I'd like to thank all of our cooperators that are able to join us today. Do we have any that would like to report out at this time? Okay, hearing none, we'll jump right into our hospital numbers. And was Kirsten able to join us with the Alaska Native Medical Center?
Good morning. This is Kirsten with ANMC. This morning we have 1 positive, not in the CCU or on a ventilator, and 0 PUIs.
Great, thanks so much. Good to hear those lower numbers. And Sean, are you on for Alaska Regional?
Hey, this is Rob Stanis. I don't know if Sean was going to join today. It looks like we have 1 COVID positive, not on the ventilator, not in the ICU, and 1 COVID recovered.
Oh, well, thanks so much for filling in, Rob. We appreciate those updated numbers. And was Nikki able to join us with Providence?
Yes, I am here. Today at PAMC, we actually have 8 COVID positive patients, 4 in the ICU, 4 on mechanical ventilation, 3 COVID recovered, and 1 person under investigation. Our ICU is pretty busy today, and we have 18 patients on vents. And we're looking at setting up some older models. We're actually doing that right now, just in case we need them. So yeah, we have a different picture at our hospital today. Thank you.
Thank you for that, Nikki. And sorry to hear you guys are so busy. It is interesting, the drastic difference in the hospitals around the Muni. And was Kara able to join us with Mat-Su Regional?
Good morning. It's Kara Cahill, Mat-Su Regional Medical Center. Currently have 1 COVID patient, no PUIs, none in the ICU. Thank you.
Great. Thanks so much. Good to hear it's slowing down out there in the Mat-Su, Kara. That is all for Liaison.
And that concludes our briefing. Just as a reminder, our next update will be June 23rd at 10 a.m. Everybody get outside and enjoy the sun. Have a good day.